Good afternoon, and thank you for joining us for this live conversation on women's health. As you may know, we're celebrating the first anniversary of our Center for Women's and Children's Health, which is very exciting here at ChristianaCare. And today we are joined by ChristianaCare's Department of Pediatrics Chair, Dr. David Paul, and our OBGYN Department Chair, Dr. Matthew Hoffman. Thank you both so much for joining us today.
Happy to be here.
Thank you, Megan. Looking forward to it.
So I'll remind our viewers real quick, if you have any questions about the building or pregnancy, fertility relating to COVID-19, please share those questions in the comments below this video, and we will get to them throughout our conversation. But before we dive into any of those questions, can you guys give us a brief overview of this exciting building?
Sure. Well, we're really happy and excited to celebrate our first anniversary. It's hard to believe that it's been a year. It's gone incredibly quickly. And we know that because of the pandemic, some of you haven't really been able to see the building or tour the building. So let me just describe it to you in a little bit of detail. It is on the main campus of our Newark campus here. As you walk in the first floor, there's a new large public lobby. In the future, there's going to be food service there and conference space and retail space. That's coming later in the year. Our large new OB triage area is on the first floor directly across from the entrance. The second floor of the building is an extension of labor and delivery. We have brand new labor and delivery rooms, a new high-risk OB area, and what we call an antepartum area, which is also for high-risk mothers and families. There is a rooftop garden between the old building and the new building where parents and patients and families can get outside if they need to decompress a little bit. The third floor and the fourth floor of the building are the neonatal intensive care unit. It is a single family room NICU, meaning every baby gets their own room, every family gets their own room, including a bathroom and a pull-out couch, to keep it simple, where you can stay overnight with your baby. On the third floor of the NICU are couplet suites. I think we're going to talk about that a little bit later, what couplet care is, where you can potentially stay with your baby. Again, that's the third and the fourth floor. The fifth floor of the new building is shelf space for future growth. We'll come back and talk about that in a few years. And the sixth and seventh floor of the building are postpartum areas. Again, single family room, postpartum rooms, really spacious, comfortable to stay overnight for families before you go home.
And if anyone hasn't physically seen the building, Dr. Paul, you made it your background for this conversation, the original rendering. So if anyone's thinking about what it looks like, it's right on that main Newark campus and looks just like Dr. Paul's background there. Dr. Hoffman, that seems like a lot of space in this building, which means we're probably delivering a lot of babies. So can you talk about kind of some of those stats we've experienced in this first year?
Yeah, no, so we have transitioned nicely. So we continue to deliver significant numbers of babies. So we are on track for about 6,000 deliveries, which is where we historically have been. I think there's been a lot of press in the last couple of days about the birth rate declining, and that is certainly true nationally. However, we continue to deliver about 6,000 a year, and we continue to draw folks from out of state, as well as serve as really referral for across the state of Delaware. So in addition to the building, we have the people. So we have maternal fetal medicine. We have the ability to do complex procedures. We have all the specialists to take care of not just normal healthy pregnancy, but folks who are having challenges.
Absolutely. And speaking of challenges, this last year has been quite a challenge for everyone. And I know when we were opening the building, the three of us talked about how care was going to have to be different in the middle of this COVID pandemic. So how have your teams had to adjust and make sure that new moms are still having that great experience during COVID?
Yeah, so I mean, it clearly has been a challenge. And again, it begins with reaching out to folks digitally. So at the same time that we launched our building, we launched a pregnancy care coach app that is specific to Delaware. So folks could find resources, learn information, think about different things and questions that they may have and get them answered literally at their fingertips. We've also done a lot with remote patient monitoring. So folks monitoring their blood pressures at home. And again, looking at kind of a text-based or app-based solution. We've shown marked improvement in outcomes, actually, even beyond our care from that perspective. Additionally, we've done lots and lots of virtual care. Continue to do that, and whether it be diabetes, high blood pressure, or following up moms after they've left our hospital in terms of supporting breastfeeding. Those are things that have accelerated during our time. And as we hopefully revert back this summer to more normal, there are things that we've known we've made it radically convenient for our parents. And how do we, in fact, continue to work within that time frame, knowing that being a new mom is hard. There's a lot of things to do. And if we can reach out to you virtually and provide you the same level of care, that's our intent.
Absolutely. And yeah, please.
If I can add to that, and I think those are excellent points, we've really transformed our care digitally and virtually. And I think you'll find when you come into the hospital, and at times that's still necessary, certainly to have a baby, our care is the same. It's the same high quality. We're always trying to improve that. The hospital is still a really safe place to visit. We have just a great track record of keeping our staff safe and parents safe. We're used to COVID. Everybody's obviously masked when we're taking care of our patients. You asked how it changed. I mean, we do have some limitations on visitation, unfortunately, due to COVID. And we've expanded that as we have been able to over the last year. And so slowly over time, we've opened that up. And so it has changed our care, but our care is really safe. I think once you come here, you will feel safe. Our staff feels safe. We're here every day. And it's still the same great care in addition to the innovations that Dr. Hoffman mentioned.
Absolutely. And Dr. Paul, earlier in your original overview of the building, you did mention couplet care, which is one of the really exciting and interesting things that's in this building. So can you talk about what exactly that is and why a new mom may have to take advantage of that?
Yeah, and when we were building the building, this is something we planned for and we're really excited about. And hopefully many of you listening have never had a baby in the neonatal intensive care unit, and we don't really want that to happen, but the reality of it is that it does happen at times, and it's really stressful. And at most times, and in most NICUs throughout the country, and other NICUs, all of the other NICUs in the region, really, if your baby's in the NICU, you are cared for as a mother and a family in a different room, in a different location of the hospital. So you're gonna have to come up and down the elevator or down the hallway, come in and out of the NICU to breastfeed or care for your baby or even visit for your baby. And so what couplet care means is that you will be a patient in the NICU with your baby in what we call a couplet suite in the same room. So we've designed these suites so you can stay there with your baby close by, participate in the care. There is a sliding door so that if you need to rest or you just feel like, hey, this is something I don't want to be a part of it this time, the nurses can care for the baby without you necessarily visualizing it. If you want to see everything, that's an option, and we leave that up to parents. And so it really promotes breastfeeding, reduces stress, and something that we've done over the last year. And again, really one of the few hospitals throughout the country who offer this level of care and this type of care. Now, it's important to know that not every mother is eligible, and specifically if you have certain medical conditions at risk for bleeding after birth or really high blood pressure, for example, that you may not be eligible for couplet care, in which case you're still eligible to visit in the NICU whenever your doctors and nurses say it's safe. And when you're discharged from the hospital, again, you can come back and stay with your baby in that room, not as a patient, but as a visitor. And it's just a really comfortable space to be together as a family.
So we are getting a few questions from our viewers. So we'll take a look at those. Our first one is from Abby. She's asking about the visitor policy and if it's still just one visitor.
Yes, David, go ahead.
Well, it's a little different in the different areas of our building. And so for a laboring patient, yes, it's just one visitor, one support person. We do allow both parents to visit now in the neonatal intensive care unit. That wasn't true earlier in the pandemic. We limited it to one, and we realized that was a hardship on families. But frankly, again, we had to keep our staff safe and our family safe and the baby safe. But at this point, both parents can visit at the same time in the NICU. There is the limitation of the one visitor in labor and delivery.
Yeah, if I could just add a little bit, we really have been trying to follow the guidance that we've gotten from the governor. I think we've seen in many adjoining states, and as COVID has decreased, that they're opening up progressively. We have plans to open up again as we get direction from our state government. And I think we're pretty hopeful that what we're seeing happening with COVID will let us do that safely.
Let me just add that, I mean, when we designed this building, and it took a long time to design and come up with the concept, we envisioned it as having a lot of family visitation and parents here and lots of family space, which we still have. And so limiting visitation isn't what we wanted to do, but it's what we had to do. And it's not something that we like to do. And as Dr. Hoffman said, as allowed, we will open that up as much as possible.
Absolutely. And reminding our viewers, if you are an expecting mom or know someone who is, and you're thinking, maybe I'm doing the fall or I'm doing the winter, will that change? Please keep an eye on our website. Please keep in contact with your physician, and we will update that as we can safely do so with guidance from the state and the CDC. That's very important, absolutely, and something I'm sure is on a lot of our viewers' minds at the moment. We do have another question come in from Lee asking, is the nursery currently open?
So Lee, I'm not sure what you mean by the nursery, if that's the neonatal intensive care unit, that's open. We don't have a nursery per se on our postpartum floors. We practice rooming in so that mothers and babies stay together. If there are times where moms are really exhausted, the nurses will at times care for the baby outside of the room and let parents rest, but there's not a nursery per se. And so if there's something more specific, if we could clarify that, I'd be happy to try and answer that.
So let's talk about that a little bit more, Dr. Paul, for people who are unfamiliar with that concept of being in the same room with their infant.
Yeah, and that's almost all hospitals throughout the country do that. It's a rooming in concept. So there was a time when I was born, which was too long ago, or my kids were born, which was even too long ago too. They went outside of the room and stayed in a central nursery, and then the nurses took care of the babies in that central nursery. But what we know is that really doesn't promote breastfeeding, that it's hard for parents to learn the care if they're not caring for the babies in the room. So the rooming in model now is mothers and babies stay together. There is no nursery. The nurses support the families to breastfeed if they choose, or bottle feed if they choose, but most of the care is done in the room and not in a nursery outside of the room. And that's true for most labor and delivery units throughout the country now too.
So Dr. Hoffman, we are getting a few questions about the labor and delivery aspect of it and in terms of COVID. So one woman is asking, are laboring moms required to wear a mask during delivery?
No, so I mean, we do encourage it if people obviously are COVID or symptomatic. Nonetheless, we're pretty lenient in other folks from that perspective. We know that delivering is challenging from that perspective, but if we're concerned that somebody has a COVID, then we certainly would from that perspective. Again, during normal processes of labor and delivery, if folks are comfortable wearing a mask, we certainly encouraging it, but we know things like pushing are really hard to do in a mask.
So let's dive a little bit more into COVID and pregnant women and that kind of risk. So I know that we are still seeing pregnant women who are contracting COVID and having very negative outcomes. So talk about those risks, especially if someone is pregnant right now and concerned about COVID.
So we have taken care of a fairly large number of moms with COVID. On the last time I looked at our numbers, we were nearing 400. So again, just as COVID is challenging, the pregnant women who do get COVID are much more likely to have respiratory issues, more likely to be hospitalized, and unfortunately, more likely to deliver early. So we are encouraging folks to consider vaccination. I know that's a bit of a challenge, and happy to discuss through those issues. And for those folks who are not ready to be vaccinated, we certainly are encouraging all the things that have been encouraged along the way in terms of general masking, social distancing, and washing hands. The good news is that numbers do finally seem to be declining within the state as more and more folks become vaccinated.
So let's talk about the benefits of pregnant women being vaccinated. I know that's been, such an important question, since the vaccines came out a few months ago, in your opinion, is it safe for your pregnant patients to receive that COVID vaccine?
Yeah, so let me just start with the upside. So, there's now been a number of studies that have shown that moms who get vaccine, in fact, provide antibodies to their babies. We've long known that moms who are immunized, and again, we do this for pertussis and flu as well, that in fact, their babies are protected by mom's immune system. And then that immunity carries over to moms who are breastfeeding. So that provides additional benefit. And again, the COVID, as in other things like flu and pertussis, that antibodies have been shown to be effective in breast milk. So we think that there is a clear up benefit in terms of babies. In terms of vaccination, although vaccination is newer, we do have pretty good data. So there are over 70,000 women now who have been vaccinated in pregnancy. When you look at the acute side effects that people get, a sore arm, feeling tired, those sorts of things, pregnant women look very similar to non-pregnant people, meaning they get those symptoms, but there doesn't seem to be any more or less of the side effects from the immediate immunization from that perspective. When we look at birth outcomes, and that's a little bit smaller, what we do see is very similar outcomes, which is reassuring. There's no more preterm labor, no more preeclampsia or blood pressure problems, no more miscarriage, no more birth defects. Now, what I will just put a little asterisk to all of that, most of our data is Moderna and Pfizer. Based upon the recent concerns about the J&J vaccine, that may be a little bit of a different story. But in terms of particularly Moderna and Pfizer, we have a pretty good track record now and are learning more. I'll also say that we're part of a learning collaborative sponsored by the NIH, looking at outcomes in moms and babies. Again, what we're seeing is that data supporting the care. Again, vaccination is not for all people, but we'd encourage folks to at least have a conversation with their provider.
Thank you. And Dr. Paul, obviously, mom being vaccinated is very important, but what about that newborn? Right now, the COVID vaccine obviously is not available as part of the vaccines that those babies get in their first year of life. But how can mom being vaccinated really help the baby and then, in the womb and now out of it as an infant?
Well, Dr. Hoffman mentioned a lot of the benefits, and we really encourage people to get vaccinated when they can. And not only moms, but dads and grandparents and siblings if they're eligible. And kids are eligible to vaccine if they're 16. And hopefully next week, that may go down to age 12. We'll wait and hear that next week. And so that's a term called cocooning. And so what we'd like to do is cocoon and keep the baby, everybody around the baby safe. And so, yes, it'll have direct effects on the mom, but if dad's vaccinated, mom's vaccinated, and grandparents are vaccinated, then you can feel really comfortable about protecting your baby. So get as many of your friends and family vaccinated as possible. For those who may be a little hesitant, maybe that's a reason that they would get vaccinated, so they can come and visit your baby or see their niece or nephew. That's a great reason among many other reasons to do it.
Absolutely. And what about, travel? Some people with a newborn in general don't necessarily want to travel to see those grandparents or those extended relatives. Would you, especially if those relatives weren't vaccinated, maybe hold off on that?
Well, that's a tough question, Megan. I think everybody has to use their judgment on that. And certainly people without babies now are maybe reluctant to travel. So I think that's a personal decision, but certainly, wait if you can to travel until your baby's over 2 months of age when they have their routine vaccinations. That's beyond the COVID vaccine. And again, the COVID vaccine isn't eligible for children at this point until they're age 16. But you have to use your personal judgment. Sometimes people have to travel for illness in the family or jobs, and it's just inevitable. And if you do that, you just have to be as careful as possible with hand washing and masking. And so there's no CDC recommendation on that specifically with babies. So it's a personal decision. You have to use your judgment. Certainly there's a little more risk to travel. And I think if you can hold off until your baby's a little older and everybody's healthy, when possible, that would be best.
And Dr. Hoffman, I'm sure most of our audience are the expecting moms we are speaking to, but some may be, hopeful moms or moms that are struggling, with potential infertility or working on their family plan. and are worried about the vaccine because some are saying it's causing infertility or other issues. So what would you say to that population?
Yeah, so the data is a little less robust in terms of that, but we do have data suggesting, again, it doesn't cause infertility. That seems to be a rumor that was started based upon the fact that one of the proteins that we're immunizing folks for COVID looks a little bit like a protein on the placenta. So that has sort of created this concern. Nonetheless, at least from the early data, we're not seeing there are any concerns in terms of infertility. So we're encouraging, again, folks to make sure it's the right decision for them by talking with their provider. But having said that, the majority of us believe that it's the safest thing for them. I think there is a misconception that young people don't get sick with COVID. Unfortunately, we've had opportunities to see that that's not true.
Thank you. And I believe we have a few more questions from the public, so we'll check in with our viewers. One of our viewers is asking if they'll have a chance to tour the labor and delivery facility and meet with the doctors who may be involved with their delivery ahead of time.
So I think there's some good news coming on that. So we are working on a virtual tour, which will sort of provide a little bit more of an opportunity to see the facility and meet some of the care team members. So with most things, it really takes a group of folks who are dedicated and looking forward to it. So our chances to showcase not just the building, but the people. So we're hoping to have that sometime in the near future. Certainly within your practices, you should be meeting the folks who would be involved with your delivery. From that perspective, again, there's often cross coverages. But the good news is the folks that we have been doing this for a while, and again, are very vested in taking care of our patients.
And again, as soon as we're allowed, we would love to open up real tours. We can't tell you when that's going to happen, but when the state lets us do that, and it's the right time, and the epidemiology of the epidemic allows us, we will open up tours whenever that is feasible.
Yeah, this certainly is not the first anniversary party that many imagine for anything, let alone a center that involves so many exciting first birthday opportunities. But before I let you both go, what would you say is the most important thing you want our viewers to understand about the Center for Women's and Children's Health and your services and just what's to come in this new center?
So I'll take that opportunity to go first. So, it's partly about the bricks and mortars, but it's really about the people and thinking about care differently. So despite the pandemic, we were already on our virtual journey to make life easier for folks before the building. But we've also invested in process as well. So we've changed our menu, believe it or not. We have looked at new ways of ordering food. We have developed a lecture series to meet both not just pregnant women, but also for women in general. So there's a series of lectures that we're putting together. And really, again, I think to Dr. Paul's point, this was a space built around families. We're looking to welcoming them back in when the time is right, and we've been given the guidance from the state.
Yeah, I think we are really proud of the care we provide here. We think we provide great care, and we're always looking to improve on that care. I mean, every day we come to work trying to make it just a little bit better. And so we welcome your feedback when you're here. If you think something is great, let us know. If you think something could have been done better, let us know. We take that feedback really seriously. But this space is about families. It's about providing a great space for families. The families of Delaware are neighbors for years to come. And as things open up, there'll just be more and more opportunities for families to celebrate in the space here. Once you see it, you'll be wowed. It's just really delivered on as promised for families. And as Dr. Hoffman said, the building is great, but it's beyond that. It's the care that we provide that we think is most important. And you may come here and think the building is great, but if we don't deliver on that care and our patient experience and the quality, then the building doesn't mean much. So the building is great, but the care of our nursing staff and the doctors and everyone else inside is what we really concentrate on.
That's great. Thank you so much for answering all of our questions today. And if you're watching and you have any other questions, please continue to leave those in the comments below, and we will get an answer to you as soon as we can. And please visit our website that's also in the comments below if you'd like to get any more information about the Center for Women's and Children's Health. Thank you so much and have a great evening.